My name's Emma Jones. I'm the primary care matron for the Enhanced Mental Health primary care team in Southampton. Our team are mental health professionals that are based within the GP surgeries across Southampton. We are able to provide signposting, assessment, triage, brief interventions, and we're working towards group interventions also. So when we look at patient referrals, when a patient presents into the GP surgery, they may see a GP or different professional, and then the referral will go towards our team, and the mental health professional will book an appointment with that patient. And that initial appointment is about assessing the patient's needs and looking at what their goals are and what support we can give them. If we're not the right service for them, we are able to signpost and liaise with other services. What this service has done is enable the patients to have a more timely service, a more patient-centred journey, working in a real recovery-focused way, so giving the ownership back to them. And Southern Health have a contract with Solent Mind, and they are peer recovery workers. So they're support workers with lived experience. They promote hope and recovery, and they do goal setting, and it is about community integration and social inclusion with the patients. And we have them in the surgeries alongside our practitioners.
My name is Suzanne Wright. I'm a peer recovery worker. A peer recovery worker is someone who's employed with lived mental health experience but far enough ahead in their journey, who's also mental health trained, and working in my case with patients, GP patients, sharing my lived experience in an appropriate way to help them feel more comfortable, to help connect, build a rapport, and looking at their barriers to help them overcome those, to help remove them. And it could be pieces of work like doing graded exposure to help people get back out the door, out the front door, or into being amongst people again. I work with people who are dealing with unhealthy relationships that's impacting negatively in their mental health. So talking through situations, helping them identify their values and goals, and part of that is helping them become more assertive.
When I found myself in quite a dark place that I couldn't think for my happiness, all I was doing is looking after my kids, making sure they're getting everything they need every day. And all I was doing is like staring in one place, not knowing what to think about, not knowing what I'm going to be doing, what my future is. And then being referred from the doctors to say that we have got a mental health coach within our surgery. Just having that trust that surgery is quite a private thing, wouldn't get help without anyone knowing, and to be able to talk and just say what you're actually feeling was me feeling better already. In my culture, you can't really talk about your feelings at all, so to be able to talk to a random person about your situation is a big help in its own. I felt there was a lot of comfort in the room. So there's no one like going to be judging you, or it's just like you don't have to build up. Everybody's on the same level at that point in that room. And then when I think when Suzanne listened to me, and then when I heard her speak, I just thought like, I wish I had someone like that. I know if going in that group has made a massive difference to me, because when I needed someone to push me, I couldn't be like, right, you need to get up today, you need to do that. I couldn't do that myself. So just saying yes to these groups, and it doesn't even have to be talking about myself, hearing the other ladies in the group, just knowing that someone else is doing better helped me a lot. Like, I remember some ladies used to come very emotional at the beginning, but by the end of it, we were laughing and we were making each other feel better. So I just think like there's not just me that feels like this every day. There's a lot of people feel really down a lot of the time. From there, I don't think I've gone backwards, because Suzanne's had a lot of sessions with me after then, You help me a lot every time I've seen you. It just, every couple of weeks, that reminder, like, you're doing well, like you're not going back into that place you were before. You're still thinking, doing things for yourself is good, still putting yourself first. Each surgery's got their own mental health coach. So it's not like you have to go to surgery because you've broken something or you've got a rash or something. It's just like, my mental health's not good, I need to go to the surgery to see the mental health coach, because my mind needs help. I need help. Yeah, that helped me a lot.
So my name is Bronwyn Evans. I am a registered mental health nurse. I am also the team leader for the Bitten PCN. I do a lot of liaison work with other services that we link in really well with. So our community mental health team, we have very close links with. We also work very closely with the local IAP service, for example, Steps to Wellbeing. We also work quite closely with No Limits. And we continue to grow and develop our network within Southampton, which has been incredibly helpful for our patients, because if we have a little bit of a complication, or if a patient is finding that actually they're being passed from pillar to post, we can stop that from happening, and we can go directly to these services and say, right, this is our challenge, this is the issues for this particular patient, this is what they need the support with, and from there we can move forward with something that's meaningful and purposeful, rather than that patient falling through those cracks and inevitably either becoming worse, becoming frustrated and losing faith in mental health services. But that's where our role is quite unique, and it's interesting because we can have that discussion and we can help them to explore things a little bit more, and just to tap into that reflective part of themselves, so that they can do the discovering themselves and then share their eureka moments with us, which is wonderful. I love hearing those stories.
When looking at accessing mental health services in Southampton, I imagine for the patient that could be quite confusing and unsure of where to go. What our team is trying to do is bridge that gap between primary care, which is a GP service, and also the secondary care, which is the community mental health team. I think patients may have found before the criteria and the threshold is quite high, and that they might fall short of that and then be left in the middle. So our service is about providing that mental health support in the surgeries. So in one given day, they might see anywhere from 9 to 16 patients a day, and then you have multiple practitioners. Part of the next year is really about developing, embedding what we do, and further looking at groups, interventions, and that psychological approach with our patients. I think a really big aspect of that is patient feedback, care and family feedback. So please do bring that feedback to us, because it is how we reflect, how we change, and how we develop the service.